Hello doctors, good afternoon. Welcome back to our classes. Dr. Swarna Balaji, online Ayurvedic classes. Today's topic is Ankylysing Spondylitis. What do you know about this Ankylysing Spondylitis? This is a topic which we'll go through in your Kayachikitsa and in your Shalyatantra regarding the diseases of spine. Okay, in this you have to concentrate on definition, clinical features, investigations and finally the treatment. What is the treatment principle you will advise to the patient afflicted with this ankylosing spondylitis? Okay, you have to write these headings in your examination point of view also. Also, this is useful in your clinical practice, the test, the investigations and all. Okay. Firstly, regarding the definition. What is the definition? This is a chronic disease which is characterized by progressive stiffness of joint, which is commonly affecting the sacroiliac joint and spine. Here, most commonly affected joint is sacroiliac joint and spine. It is a chronic disease which is characterized by progressive stiffness. Means the stiffness will be increased as day progresses. And the most commonly afflicted joints were sacroiliac and spine. Next, this disease has a strong hereditary history. In most of the cases, in a family, if a person afflicted with this ankylosing spondylitis, there were many chances to transfer this to his or her family members. Means it is not communicable. This may be associated with some hereditary factors. To his progeny, to his or her progeny, there were chances of this ankylosing spondylitis. Next, coming to clinical features. What are the commonly seen clinical features in this ankylosing spondylitis? Most commonly seen in young adults. Males are more affected than females. And low backache will be the most commonly said symptoms. Tenderness will be noticed. Stiffness of spine is seen. Initially, the stiffness may be noticed after a period of rest. The movement will be improved after a period of rest. Okay, these were the clinical features. What are they? Back pain, stiffness, tenderness, and if that person take a rest at that time, the movement may improve. Males are most commonly affected. Next, what are the investigations? Schober's test. SCHOBERS. Schober's test. This is the test which is used for the accessing the mobility in the lumbar spine. How we have to do this Schober's test? I will mention you in a diagrammatic representation so that you can understand easily. And this Schober's test is the most common thing which you will do in your clinical practice also in the patients who came with the complaint of the low backache. Okay, this may be asked in your Viva point of view also, so that I am providing you the clear details. You will see a diagram in the right side of this video. The diagram is not that much clear, but I'll mention you. I'll provide you an explanation regarding this diagrammatic representation. Ask the patient to stand in a straight manner. Don't bend. Stand in a straight manner. You have to ask that patient. Later on, mark L5 vertebrae in that particular patient. Mark L5 vertebrae. Next, mark the point 10 centimeters above the L5 vertebrae and 5 centimeters below the L5 vertebrae. Next, ask the patient to bend forward as they can. Means you have to ask the patient bend forward as much as you can. Don't stress. Next, if you measure the distribution between the 2 points, if the distance is less than 20 centimeters, if the distribution is less than 20 meters, at that time restriction in lumbar movement will be noticed by you. Okay, this is the test Schober's test, which is noticed for the accessing the mobility in a lumbar spine. Okay, next. Move on to treatment. Other than this Schober's test, you have to ask the patient to do CBC, complete blood count, CT, MRI, X-ray, spine, ESR and CRP. Next, treatment. What are the treatment procedures? Analgesics like ibuprofen, diclofenac, aspirin and all. Next, advise him physiotherapy, radiotherapy, yoga and osteotomy of spine will be done in that particular patient. These were the treatment principles which you will advise to the patient afflicted with this ankylosing spondylitis. Among this entire topic, what is the important thing is, what is the definition of this ankylosing spondylitis and what is Schober's test which is done in this particular ankylosing spondylitis. You have to ask the patient to stand in a straight manner with no bending. You have to mark the L5 vertebrae and you have to mark 10 centimeters above the L5 vertebrae as point B and 5 centimeters below the L5 vertebrae as point C. Then take the tape, ask the patient to bend forward as much as he or she can. Don't stress, you have to say, and you have to measure the distance between the 2 points so that you can notice. If the distance is less than 20 centimeters, you can notice the restriction in the lumbar movement. This completes our topic ankylosing spondylitis. What you have to do is listen to this video, go to your examination, attempt all those headings which is said by me, like our video, subscribe to our channel for getting more and more updates through us. So what you have to do is like and subscribe, share to your friends and juniors. This completes our session regarding ankylosing spondylitis. In the next video, we will discuss more and more like disc prolapse and diseases of spine and all. Okay, thank you. Stay tuned for more updates. Soon we are planning clinical approach of our Ayurveda in general practice that will help you regarding your clinic and prescription purpose also. So that stay tuned to our channel. Thank you.